The primary goal of Kahala Nui is really about enabling the seniors that we serve to live their lives to the fullest and to be treated with respect and dignity. And this pertains to individuals, whether they are independent, whether they need some assistance, or they require 24-hour care.
So when I started out in social work, I concentrated in gerontology, and my second job actually was with HMSA, and I was a case management coordinator. In that program, I got to work with patients with advanced illnesses like cancer, COPD, CHF, and I found that I most enjoyed working with cancer patients and their families.
Well, the vision for Pu'ula Lanai, as set out by Larry Ellison, is that the island would be a sustainable one by every definition of the word sustainable. So certainly environmentally, but economically, and all the other pieces that make for a strong community. And so our goals are to enhance, strengthen, build capacity in all areas, whether it be education or employment or small businesses, to make sure that all of the factors that go into a community are firing on all cylinders, if you will.
Our residents get priority access to whatever level of care they need, and they get that service at a discount. So really they have a built-in long-term care insurance policy. So, you know, they don't have to worry about care for the rest of their life. For seniors, you know, they really don't want to be a burden on their families. And having a life care benefit, they know that they're going to be cared for, and their families don't have to worry about them.
I feel it's really a privilege to work with our patients and their families in a very sacred time, and also being part of our team. I have to say, our team at Kaiser Oncology Clinic. I feel so blessed to be part of this team and in this job. I can truly say that this is my dream job, and I'm so thankful to be able to do what I do.
One of the goals that we have is the improvement of healthcare on the island. And so we're not healthcare providers, but we're looking at where are the gaps, where are the redundancies. One of the gaps that we saw when we first got there was no pharmacy and no hospice care. And so those were two things that the community asked for right away when we did our baseline survey. And so we're delighted that Hospice Hawaii is on Lanai providing hospice care.
I think what Hospice Hawaii does is they provide compassion, and they provide support for the individual that is facing this situation.
Each agency, of course, has their different strengths. You know, Hospice Hawaii is definitely great for families with kids. I know they're, you know, very strong in that aspect, as well as, you know, all the other, you know, services and disciplines that are involved in the care of patients.
It brings the family closer, provides support. They provide everything from, you know, healthcare support, but also spiritual support, and helps to make the end of life that can be scary for the patient, sometimes can also be scary for family members. I would ask them to consider hospice, consider getting in touch with hospice as soon as they are comfortable, because it really does make a difference both in the patient's life and in the family's support.